College, and today I am performing a G-tube irrigation and site care. But first, I'm gonna do a LPN welcome, and then later the end step. So right now I'm gonna put a hand sanitizer in my hands. I already washed my hands, so right now I'm just performing a hand sanitizer. It's for 20 seconds, and then when the sanitizer is dry, I can put a gloves and start my um, LPN and welcome.
And then one of these skills. So some vital signs, always up and up.
Good morning, Miss Thin Lizzie. My name is Karen Warren. I'm gonna close the privacy curtain. And I'm gonna look up your information. Thin Lizzie, date of birth 5/30XX. Yes, yes. I have my protocol here with me, and I have all my equipments that I gathered to perform the G-tube irrigation and site care. So right now, I already did the LPN, and I wash my hands like I said before, and redo the sanitizer. And I'm gonna explain the procedure to you, which is we're gonna do the G-tube irrigation and site care, and your ID, and I'm gonna get you into a comfortable position. And the privacy curtain is on. And are you feeling safe? And I'm gonna apply a modesty on you, okay? Oh, you have a bandage on. So we're gonna, in our site care, we're gonna change it, okay? Are you feeling comfortable? You're not that cold? It's not gonna take time. I'll try to do it as fast as I can and safely. So I'm gonna put a rag because I am a messy nurse. So I'm putting all this towel for spills, and I have a washcloth for it to clean. I will ensure the proper placement. It's the pH and the X-ray are already done a while ago. So prior to doing this one, you already had your X-ray and your pH checked. So now I am gonna change my gloves so that I can touch that thing over there and auscultate the using a stethoscope, place over your epigastrium and listen for a whoosh sound. and I'm gonna put 15 on it. And I'm gonna open this tube. The tube is 10 mm. It's 6 centimeters, 16 FR French. And I'll document that. I'll crimp the hose so that it wouldn't spill. And I will do that one, and I'm gonna listen to the whoosh sound. I hear the whoosh sound. Perfect. And I'm gonna take away my stethoscope. I can rest this one for a while because it's safe. I'm gonna put back my mask.
The night before got super sick too. Yeah. We ate McDonald's. I'm like turned off from McDonald's forever.
And after I check the whoosh sound, I'm gonna
Every cold pulse, can I check the second
attach the
one, or
syringe in the end of the feeding
You
tube,
can
then
check out
getting a
either
pull
one.
back
This
plunger
is the best.
to aspirate. I'm gonna aspirate the residual fluid
So I can just do.
until it stops.
Yeah.
We still have more time. We still have 2 weeks. No, we have 1. We have next Wednesday, not that. Oh, crap. Well, it's okay. To do all the vital vitals.
That's what we were hoping to do today.
Grab that chair so I can do yours. This next weekend, though, just for our then we'll have time during lab to do something.
It stops at the residual fluid stops at 30, and I check for chunks, blood, and sign of abnormalities. But it has a little bit of acid from the stomach, but it looks perfect. So I'm gonna push back the same equivalent of fluid slowly. The volume of the liquid is within the normal limits, and I'm returning it slowly to the stomach. So I'm gonna crimp it, and I'm gonna put it back. And I'm gonna close it. Oh, I'm gonna flush it with 40 ml of normal water, or lukewarm water that is not hot or not cold either. I'm gonna flush it. So here's the 30. So here's the 30 ml water. I'm gonna flush it. Slowly. And I'm flushing it. I'm flushing the tube. and the tube irrigates easily. So I'm gonna clamp it again, crimp it, and I'm gonna put it back. And then I'm gonna cover it. So I'm gonna take off the gloves and then take another gloves, and I'm gonna do a wound care or site care. Sorry. So I throw um, the old gloves and have a new one, and I'm gonna take off the tape in the gas so that I can take it off easily. And while doing that, I'm gonna try to assess what kind of, if there's a draining or a bleeding going on, assess the site. The gas is clean and there's no visible blood, and it's not heavy, it's dry. And I will throw it out, and I'm gonna assess the surroundings of the skin. It is perfect. There is no redness, tenderness, or signs of blood or drainage. So now I will clean the site with the tube. I have the washcloth here, and I'm gonna put it in the lukewarm water. Oh, it's not cold, it's not hot. So I'm gonna do a fancy fold in my hand. And I will not, I will only tap it and not to scrub it because the skin are tender around the area. So I'm just gonna put it there. Tap. Use the other side. Tap. And it's clean. So I'm gonna pat dry it, but I'm not gonna rub it. It's dry and there's no moist. So I'm gonna apply the gas. And if you don't have a scissor, you can cut it in there so that it can go around in the back of the plastic circle in the G-tube. And I already have a tape here ready that has my initial, it has time, and it has the date on it. So don't put the tape in the skin of the patient. Okay. So the irrigation, the G-tube irrigation, and the site care or site assessment and care is done. And that's the end of my G-tube irrigation and site care. And now I'm gonna perform the LPN, which is I'm gonna make the patient comfortable, which I'm gonna keep the patient in 45-degree angle because the system is feeding right now or connected to the G-tube. So I'm gonna clean up and make her comfortable. Are you comfortable, Miss Lizzie? Okay, I'm gonna take off my gloves and dispose it properly. I'm gonna disinfect my hands. And I'm now performing parts of my end, so I ensure Miss Lizzie Thin's comfort and safety. I had a bed lock and in the lowest position. And do you have any concerns, Miss Lizzie, about your G-tube irrigation and your site care? No? Oh, okay. I disposed all the materials that I used properly. Put the bloody gas or some of those things in the hazardous bin. And I washed my hands and I disinfected it again. And I'm gonna open the curtain and I will document my assessment and my site care and the irrigation. Thank you.